Hi, my name is Dr. Ruby Shrestha. I'm with Lifestages Centers for Women in Dayton, Ohio. I was born and raised in Kathmandu, Nepal. I came to the United States when I was 18 years old. I did my undergrad at University of South Alabama in Mobile, Alabama, and then did my medical school at Jefferson Medical College at Thomas Jefferson University, and I did my residency at Abington Memorial Hospital in Abington, Pennsylvania. I have been with Lifestages for 11 years now. The science of the medicine is what got me into medicine, I would say, but I guess the art of the medicine is what got me into obstetrics and gynecology. I grew up in a very closed family with lots of sisters and cousins and aunts, so I kind of were among female pretty much all my life, and they raised me, and that always, I just had that connection. And when I did all my rotations, I felt like, I really connected with these patients, and I felt like, I could help them and understand them, and so I think that's kind of got me. It's just that human connection. I feel like that's what kind of got me into obstetrics and gynecology. My philosophy here is mostly patient education, and then I would say shared decision making. For the most part, I do not make decisions for people. I give them the options. I give them the education. I give them the options, and then we kind of make a decision between the patient and me. And I look at the patients as a whole. We come from different cultures, different backgrounds. Whatever works for one person doesn't work for everybody else. There's different ways to treat a disease or even a problem. So I think that's what's important is you kind of look at a patient as a whole. You tell them these are the options, and then the patient make that decision for themselves. Because we're such a group-oriented model here, we do what's best for the patient. Like whoever is the best in one field, provides that for that patient. So we have in a midwifery program, we have centering program which actually Lifestages is the first one in Dayton, Ohio that started the centering program. It's a group prenatal care where we have the patients of the same gestational age. They all come for their prenatal visits, and they're all with each other. They share their stories, and that kind of feels like just kind of listening to each other. You have that female bonding, and I think that really empowers women and do the best they can for themselves. So we have that program here. We have your gynecology program, and then Dr. Kaufman, she does the single-site hysterectomies. We have doctors who do robotic surgeries. There are others who do more bigger uterus with abdominal hysterectomies. So a new patient should consider Lifestages Centers for Women because of the diversity of the services and the diversity of physicians. Also the access to care from north to south, and the availability of the appointments. What I love about the OBGYN field is the happiness and the relief that I see in patients when I get to deliver their babies that we've taken care for 9 months, or a patient who has infertility and finally I can deliver their babies. A patient who has been anemic all their life because of big fibroids and heavy bleeding, and they just thought that was normal. And now we come here and we take care of that uterus, you take the uterus out and they're not bleeding anymore. And then just the newfound, energy they have, just that happiness that I see in them, that's what gives me the satisfaction.